Hi, everyone. Can you hear me? All right, cool. Thanks again for joining us. I'm going to dive in with some high-level stuff, then hand it over to Director Bond for a quick update. And then we're going to talk about food in New Haven. Our team has been working very hard with many partners in the community to support access to food, and just had some things that they wanted to share. So we're at 1,253 cases right now that are confirmed and 42 fatalities. A quick update on the testing sites, the new testing sites that are up and running now. The two that are up and running, the third we're still working on some legal issues around it. But the Fairhaven site and the Cornell Scott site on Dixwell Avenue started today, and I checked in with both of the sites earlier on today, and they said that they were already getting a ton of people going to the site. Cornell Scott said that their phone number was swamped, their call center was swamped with requests, and that both sites filled up their first day with testing already. And the capacity of the sites is around 20 to 30 people each day. But that's a good indication of the need in the community for those sites. So we're excited that people are already benefiting from them, and also, again, very grateful for Cornell Scott and Fairhaven Health for stepping up to help out with the testing. I also wanted to mention that on April 15th, there was a 26-year-old that died in the Whaley Avenue Correctional Facility. The individual is a Hartford resident, and as the press, I think, knows, the Whaley Avenue Correctional Facility, even though it is located in New Haven, is a state of Connecticut Department of Corrections facility that we have no control over. Nevertheless, we wanted to share with the press this information because we thought it was important that the press knows, in particular because it's a younger individual, and obviously in a very unfortunate loss to the state. Also wanted to, before I hand it over to Director Bond, mention that Yale Hospital has reached out about a decrease in the number of emergency room visits from non-COVID related patients. And they suspect that, and this is a trend that I've heard from other hospitals as well, they suspect that it's because there's a lot of fear around emergency rooms and people going to hospitals, and they want to encourage people that if they need medical care, that they should seek medical care. If people are having strokes or having heart attacks, those issues that require urgent attention, they want to encourage people to get that attention. And that the hospital has safeguards in place to make sure that people are protected. But they wanted to make sure that we help them get that message out as well, that their concern about people not seeking medical attention is something that they want to make sure the public knows about. So why don't I hand it over to Latha and Carla to talk about food. And just to tee it up, I think that of the issues that we've heard about in the community regarding basic needs, this has been the most frequent concern from the community. And I know that in normal times, this is already a challenge for cities like New Haven to make sure that residents have access to food. But this situation with COVID-19 has exasperated this situation. And I know that our team has been working very, very hard with quite a complex situation about how to give people access to food. And Latha and Carla can share the complexity of the issue and the many ways that they're trying to make sure that all New Haven residents, as much as possible, have access to food.
Great, thank you. So I'm Latha Swami. I'm the Director of Food Policy for the city. And as the mayor mentioned, really during this time, the city is really focused on making sure our most vulnerable residents are able to have reliable access to food. We've been working diligently with community partners across geographies and sectors to collaborate, communicate around the challenges and solutions that we're looking into, so that we, move forward in an informed and efficient way. So I'd like to highlight a few of our initiatives that center around a couple of priority populations. So we have youth, seniors, and low-income individuals and families. For youth, we're distributing grab-and-go meals across 38 school sites for students who are 18 years old and younger. The sites are open for breakfast and lunch pickup on Monday, Wednesday, and Friday between 9 a.m. and 12 p.m. And each of those days, you can pick up 2 days meals. And so essentially, if you are able to visit for each of those 3 days, you receive 6 days worth of meals. For seniors, we are we have implemented a program where we are working with community partners through the Elderly Services Department, and New Haven residents can receive food pantry items and also meal deliveries. So residents who are 55 years old and older can receive these food pantry items, and those who are 60 years old and older can receive the meal deliveries. For low-income families and individuals, we are really trying to support the food pantries and soup kitchens that already exist in New Haven. They're working really hard to continue to remain open. And so the city has been supporting food pantries and soup kitchens in modifying their operations, especially in order to adhere to public health guidance around social distancing and proper protective measures. Specifically around food pantries, we have some food pantries that already were operating in some police substations, and we've facilitated the reopening of the police substations for the food pantries specifically. We have one in Fairhaven, Dixwell, The Hill, and Dwight. Those substations are now approved for operating their food pantries. Another really exciting program that we have is a food pantry delivery model. Specifically, this is separate from the senior program. It's a collaboration among members of the Coordinated Food Assistance Network, known as CFAN. They're organizing delivery of pantry items directly to homes. So specifically, they're prioritizing high-risk individuals, those who are older adults, those who cannot or should not be leaving home right now. So right now, the deliveries are happening on Monday, Wednesday, Thursday, and Friday from 3 local pantries. That's Downtown Evening Soup Kitchen, Loaves and Fishes, and the Keith Center in Hamden. Just to give you an idea, this delivery program has only been operating for about 4 weeks. But since they started, they've had 64 volunteer drivers. They've delivered over 1,000 bags of food, and they've delivered to 784 homes. We have a couple of things in the works. We're actively working to expand access to food, in more ways beyond what I've already outlined here, especially for vulnerable residents who may utilize benefits like SNAP. One initiative that I'm working on we're working on with Congresswoman DeLauro's office is to advocate for a fast-track implementation of online purchasing for SNAP users in Connecticut. Right now, the online purchasing platform for people who use EBT cards is limited to about 10 states, but a couple of states have been coming online with this program. It was originally piloted, but now we're trying to advocate to have this program open up in Connecticut. So that would really help a lot of individuals who are already on SNAP. And as we see this crisis move forward, we'll see a lot more people applying for SNAP benefits. And lastly, I really want to highlight we have this really cool website now. If Mayor, if you wanted to pull that up. So you can access the website from the main COVID website. You'll see the
That's
link.
me.
Yep. And see the food resources. We have food resources page. And the first thing we want to highlight is we have an interactive map. And if you go to the map, we have the sites, the school meal distribution sites, we have food pantries and soup kitchens. And you can see which ones are open near you. We can just demo that for you with City Hall. So within that radius, it'll bring up the closest food pantries, soup kitchens, and school meal distribution sites. We've included ones that are open and closed, and then also a few that are to be confirmed. They're kind of in a, it's dynamic, right? These operation hours are changing daily, and we are updating this just as frequently. So we have info on the specific sites, details on the modified operations, and just to be very clear, for any of these resources, they're open to everyone. No proof of income or residency status is required. Of course, for the school meal distribution sites, as I mentioned, it's for youth 18 years old and younger. But for the other sites, no proof of income or residency status is required. Some of the food pantry sites may use food that they've obtained from the federal government, and that requires a self-declaratory form of eligibility, but there's no otherwise proof that's required. And I think that's a lot of the food resources in a nutshell. If you really need to find out more information, I advise you to go to the food resources page. It will be updated very frequently. We'll be putting content onto it as we launch and move forward with additional initiatives. So this is where you could find information. Thank you.
Thanks, Letha. Carla, do you have anything to add, or are you good to go?
Sure, I just wanted to thank you, Mayor. Thanks, Letha, for that great rundown. I just wanted to add a few more statistics around the food that we've been able to facilitate for seniors over the past 4 to 5 weeks. In our partnership, the partnership between the Elderly Services Department and Vertical Church, we've been able to do about 850 mobile pantry deliveries with more than 1,500 bags of food. And in the partnership between Elderly Services and LifeBridge, we've been able to deliver more than 1,100 meals.
Great, thank you. And I skipped over Director Bond. Do you have anything that you'd like to add? We can't hear you.
Oh, could you hear me now? Just minor changes from the data that I presented yesterday for the nursing homes. We had 2 additional positive cases at the Regal Care Center. We had a untimely death, additional death at Mary Wade. Grimes Center seems to be steady with no changes, and then Advanced Nursing has a positive resident that is new since I reported yesterday.
Thanks, Director Bond. Any questions from folks? Hi, Tom.
Hello, thank you.
We'll go to Kyle. That's not you. We'll go to you next, but go for it, Tom.
Thanks. So maybe since Director Bond just presented, I know you mentioned the new cases. Any chance you can mention the total, like today's totals for Regal Care and Mary Wade and Grimes? I know you said how it's changed, but if you have those totals present, that would be helpful.
Director Vaughn?
Unmuted. Sorry, I keep getting muted. So at the Grimes Center, I'll start there. They had the residents total of 58. 33 are in the facility that are positive, 3 are hospitalized, 17 have recovered, 2 have been discharged to home, 1 had an untimely death at the facility, and 2 at the hospital. And they still have 18 positive employees. Mary Wade, the residential side, have a total of 15 positive residents. 14 of those are hospitalized, 1 untimely death. Their skilled nursing facility side has 25 positive cases, of which 12 are in the facility, 5 are hospitalized, 6 untimely deaths, and 2 untimely deaths at the hospital. They have a total of 19 positive employees, 3 that are non-clinical. And then you have Regal Care, that you have the 21 residents total, 10 are in the facility, 11 are hospitalized, 9 total staff members. And then Advanced Nursing now has 1 staff positive, 1 resident positive.
Thank you very much for that, Director Bond.
You're welcome.
And over to Latha. Maybe first, Latha, if people are interested in, I guess, signing up for any of the programs you mentioned, especially the kind of delivery for seniors, where do they go? Do they go to the website you referenced, or is there another place that they can sign up for any of these services?
Yeah, so you can find information, or actually the link to where you need to go for this, for signing up to volunteer, especially for the delivery program. CFAN will soon have a web page, so I will make sure to link to that new web page. But for right now, CFAN's website is hosted on CARE's website, and there's information on how to volunteer there. There's also information on how to volunteer on United Way's website.
And for seniors in particular who are New Haven residents, they can go through our Elderly Services Department to put in requests or for triaging around mobile pantry and meal delivery.
Thank you. And Latha, could you speak to how the city is feeding homeless individuals who have been put up in hotels? I'm not sure if that falls onto you, if the mayor wants to speak to that. I know the mayor mentioned a few weeks ago that the city is covering food costs there.
Correct. Latha, do you want to take the first stab?
Yeah, so we are working on, you know, through this emergency food situation, we're trying to structure a system where we are working with restaurants to provide food to homeless individuals that have been placed into the hotels right now, and we're working on that right now.
But so currently, correct me if I'm wrong, Carla, but we're cycling through different restaurants who deliver food to the hotels. Logistically, it's a little bit challenging, but Carla's been taking the lead on that. Do you want to add anything, Carla?
Sure. So to date, we've worked with some restaurant partners to deliver meals to the folks who are currently housed in hotels after the decompression of the shelters. As Latha mentioned, up until very recently, we were still working within the confines of the public health crisis and sort of an emergency feeding situation. But to her point, we are working on putting a little more structure around that in place moving forward.
And unlike other scenarios, obviously people can't prepare meals in a hotel, so that we need to provide prepared meals to the folks that are there. Tom, can I go to someone else? And if you have another question, we'll come back to you.
Certainly, thank you.
So I think I saw Dominique waving. You have a question there?
Yes. Good to see you, Mayor Elicker, and thank you for your time. My question kind of falls under the guidelines of the testing centers. I had the chance to speak with some of the health directors there, and one of the key points that they kept reiterating was the point that these testing sites that were just put up today really help some of the hotspots areas within the city. Can you talk a little bit about making sure that you have the testing sites there readily available for some of those areas that may not have access to get to through the drive-through testing sites?
Absolutely. So we're very fortunate in New Haven to have two larger testing sites, the CVS site and the New Haven Hospital site. But since those sites are far away from some of the neighborhoods where we're seeing a very high number of cases, we felt it important to locate additional testing sites within those neighborhoods. We've stood up two sites so far, one in Fairhaven and the other in the Dixwell and Newhallville neighborhoods. And Cornell Scott and Fairhaven Health have been taking the lead on those, and we're very grateful for their support. And they're processing about 20 to 30 tests per day. About 15, every 15 minutes, they will schedule a new appointment. The test turnaround times are slower than the CVS rapid testing. They take around 2 to 3 days to get the test results. But nevertheless, because people don't require a car to get tested, and they're right in the neighborhoods, we're seeing already today a lot of popularity of those sites. You know, at the end of the day, the most important thing for us beating this virus is being able to test a lot of people on a regular basis and pair that with contact tracing so that we can identify future outbreaks and get them under control in a very quick manner. And so this partnership with our community health centers is a key to that.
Mm-hmm. And then I could just add to that, and then we're also having the private partnership with another provider to expand testing. And so we know that with testing and contact tracing coupled, we can really work on flattening the curve. And so that's been our focus on trying to ensure that we have a combination of both, and then making sure that we're increasing access to communities that would not have otherwise.
And we'll be announcing the location of that third new site shortly once we finish the negotiations.
Thank you both. Thank you.
Yep. Questions?
Speaking about contact tracing, how is that working? How many people do you have doing that? And has it proven to be effective at all? Do we have any research that shows that it's been effective thus far?
Absolutely. So we actually just did an interview earlier today. And we've been having a lot of interest from a lot of different individuals regarding the contact tracing effort. So from the beginning, the New Haven Health Department made a commitment to ensure that we first and foremost identify positive cases, work on isolating individuals or quarantining individuals, and then third, contact tracing as an effort to try to ensure that we are doing index interviews for those that are positive, identifying any other potential individuals that have been exposed, then doing contact notification of those exposures so that they can then be able to also isolate or monitor their symptoms to then contact their provider if they develop symptoms to get tested. So it's very critical. It's been a proven model in other countries that it works, and so we want to make sure that we are working really diligently on expanding testing and then also ramping up our contact tracing efforts. We have partnered with Yale University to engage their medical students, nursing students, PA students, and public health students to help us with this effort for capacity. That has been a very successful model. And so we currently have over 160 volunteers helping us with this process. We developed a platform where we monitor everyone through our system and then conduct a contact notification in addition to that. So it's been really successful. We are working really hard on making sure that those entities that are requesting tests are completing forms correctly, because we do have a discrepancy with some of the incomplete data, and so that makes it difficult to contact individuals when we have incomplete field. And so we issued a memo last week informing providers that are issuing test orders to make sure that they're completing the fields, because it really all plays a part with effectiveness in contact tracing.
Thank you. And
You're welcome.
Mayor, I had a question for you. So just about an hour ago, Harvard University said they're not going to take this stimulus money. I know Stanford, Princeton, they have also done this as well. Do you want to weigh in on Yale? They have a $30 billion endowment, and they're set to receive about $7 million from the CARES Act.
I didn't realize that other universities were turning it down. I do think that now is a time when those that are struggling the most need the most support. And we're talking with our city's budget office about extreme shortfalls in our own budget because our revenues are significantly down. And there are so many people running small businesses in the community, so many people that have lost their jobs. This is a time to invest in those people that are struggling the most.
Have you spoken to Yale about it at all? Or?
I have not spoken to Yale specifically about that $7 million. Other questions? I see Tom.
Thank you. What's the latest in terms of conversations between the city and Yale about anything? I know that you all have been in negotiations about potentially opening up rooms for people to stay. Can you just speak to recent conversations with Yale leadership?
So currently there is one firefighter that is in one of the dormitories at Yale. However, we are still in negotiations with Yale's lawyers to come to an agreement about what the understanding would be as far as New Haven public safety individuals staying in the dorms.
Thank you. I'm very sorry to hear about the 26-year-old Hartford resident who died at the Whaley jail. And this is the first that I'm hearing about, even though it seems like it happened 9 days ago. Is there anything else you can say about conditions around this person's untimely death, whether COVID-19 is being investigated by the state as a potential cause? And also, do you have any updates on the 31-year-old who died in New Haven's lockup about a week ago on April 15th, I believe?
So I can check with the chief on the updates on the 31-year-old. Again, to reiterate, that individual, there was no indication that the death was related to COVID-19, but I'm happy to get you that update. I appreciate that question. I found out about the individual in the Whaley Avenue correctional facility today, and that's why I felt like it was important to share it with people. I don't have any other additional information on the individual. I direct you to the State Department of Corrections to get more information.
Thank you. And do you have any updates on how testing at CVS is going? Do you know, have they ramped up to 1,000 a day, or any other updates on how things are there?
Can I refer that to Rick?
Please.
Sure. Good afternoon. So they have not ramped up to 1,000. They've on their days. We've seen anywhere between 650 and 750. Yesterday we had 367 due to early closure due to weather. We expect by Friday to be up and running with lane 4. And once lane 4 is up and running, we expect that number to get up to 1,000. They've been it's been a very efficient operation. Again, it's been handling first responders and frontline workers throughout the state, and it's been very good.
Thank you, Rick. And then Mayor, I mean, I do have 2 more, but I know I've asked a bunch in a row.
Go for it. No one else seems to be anxious to ask.
What are some of the legal issues that the city and Dr. Murphy are working through before you all announce where his testing site's going to be?
I prefer not to get into the legal issues. It's not anything that is unusual, and it's more about the site that will be used rather than issues with Dr. Murphy.
Will the city be contracting directly with Murphy, or is this a state deal with Murphy?
The state is not involved.
So it's the city.
Correct.
And is the goal to have Dr. Murphy open up in another, like Dixwell and Fairhaven, in a majority minority community, easily walkable? Is that the general goal with where this will be located?
Correct.
Mm-hmm.
And then my last question.
I just want to add that it's also going to be a walkthrough site. So it's for individuals, that have bicycles or walkers that do not have transportation.
It is important with all three of these sites that the terminology of walk up does not mean that people can show up without an appointment.
That's true.
We don't want people to overwhelm the sites, and we don't want a lot of people showing up at once who may be contagious. And so people need to call in advance. The point of us saying that people can walk to the site is that they do not require a car in order to get tested.
Thank you for that.
Yep.
Thank you. And then my last question for you, Mayor, is about Earth Day. Today is the 50th anniversary of Earth Day, and I know that, at least from what I read, there doesn't seem to be much of a direct connection between the spread of coronavirus and the pending crisis and current crisis of climate change. But I know there's been a lot written about how this country's lack of preparedness to respond to COVID could just be a trial run for lack of preparedness for responding to climate change. I know in your budget you have proposed dedicating a certain amount towards climate sustainability initiatives. Have you been thinking at all about any parallels between COVID-19 and climate change, particularly in how city government might best respond to those crises?
Yeah, I think that we're thinking a lot about the COVID crisis has shown, number one, just how important it is to work together, and number two, what happens when we don't work together, when we don't have foresight, when we don't prepare for future disasters. And I think it's quite clear that we've seen at the national level a response to the COVID crisis that has been almost completely unprepared, has not taken the issue seriously, and continues to give conflicting messages that are unproductive on how our community should respond to COVID. And I think that same behavior and approach has been done regarding climate change. At a time when we're facing so many crises in the world, we should be working together with our partners across not only the country, but the world. And climate change, I think, is quite a close parallel to what's going on with COVID-19 and what we need to do together to address the problem. And some of this is about when you see our local government and how local governments have taken on much more responsibility when there is a lack of leadership at the national level. New Haven has been a place, and I talked about this morning at our press conference, where we're working to step up and support our regional, our surrounding towns with the CVS site, with this additional site that will clean masks for first responders and healthcare workers. We are with individuals experiencing homelessness that oftentimes come to New Haven for resources, but will identify other towns as their places of residence. We're stepping up to try to support the surrounding community at these times of crisis and working together. And I think that climate change very much so is the same thing, where we need to all work together and step up to respond to it. One last thing is I signed a proclamation earlier today about how we need to do more to address climate change. And I personally signed a commitment to do more things on my own side. And it's everything from changing the type of soap that I use, to using more reusable bags, to riding my bike even more to work as much as I can. And I think that it's important for us all to, particularly those in leadership roles, to be an example for many people around us of the actions that we can take to reduce our impact on the climate. Maybe that was more than you were expecting.
That's great. Thank you very much.
You're welcome. Any other questions? All right. Well, thanks everybody. We'll see you all soon, probably tomorrow.